CBS News senior foreign correspondent Mark Phillips is joining me now just southeast of Milan. Mark, what do you see there?
Well, we're just outside of Codogna, about 7 kilometers, 5 or so miles away. This is the limit of the area of northern Italy that has been affected by the virus outbreak, and the numbers have continued to rise. The latest Italian health report here says there have been more than 50 new cases overnight, and that the total number of those afflicted is now approaching 300.
Police have cordoned off areas near Milan and Venice where about 50,000 people live. But the question is whether all the cases of the virus reported in Italy can be traced to this region. In Venice, where this is normally carnival time, the party's over, canceled days early. The masks have changed, and people are getting out of town. As everywhere, the deaths associated with the virus have affected the most vulnerable. Luigi D'Angelo is coordinating Italy's emergency response.
The doctors told us clearly that the people have died because they were infected by other problems of health.
They were already sick.
Yeah, they were already sick, and the coronavirus has amplified their sickness.
The World Health Organization hasn't pressed the panic button and has refrained from calling this a pandemic. This is not an uncontained global spread, they say.
The disease, it's still possible to be contained, but if some fail, if some do not do everything that is needed, this can still become out of control with dramatic consequences in global health and global economy.
All right, Mark, the chief medical officer in the UK has said that anyone returning to the country from lockdown zones in northern Italy must self-isolate. What does this mean for travelers? And if you're self-isolating, how is it enforced?
Well, what they've said is, it's a bit finer definition than that. They said if you're showing flu-ish symptoms and you've been into this area, then you should isolate, which is basically stay home and limit your contact to other people for a period of 2 weeks or so. And it's part of general recommendations that have been put out in by health authorities around the world, this one from the UK, affecting not just Italy in this area behind me here, but also Iran, where there has been an outbreak, many other countries where there have been outbreaks as well. The concern right now is whether or not this disease, this coronavirus, will move into a second stage of spread. Right now, it's been pretty well isolated in Asia and East Asia and China, Korea, Japan, that kind of thing, with isolated cases apart from the clump here in other countries. But the worry right now is whether or not other clusters like the one here are going to show up elsewhere, and whether this cluster can be contained, as it now appears to be more or less in the north of Italy, or whether cases start showing up around the country and obviously by extension around Europe and further afield.
Right. So when I saw that Venice had canceled the carnival, I thought, man, you know, Venice has been hit over and over again this year between the flooding and now the carnival, and they really depend on these cruise ships and all this tourism money to flow in. There has got to be concerns about the impacts that the coronavirus will have on the local economy. Venice is just sort of one example, but are there others?
Well, it's very much a question of hell or high water, and that's the choice right now. High water happens from time to time. This is a form of hell. This is really a crucial economic area of Italy. Something like 40% of the GNP in Italy comes out of this area that we're in now, the area around Milan and stretching eastward toward Venice. This is really the driving engine of the Italian economy, certainly in manufacturing terms. And you mentioned tourism as well. It hurts. And the longer this goes on, the more it's going to hurt. Yesterday's market drop in New York was another example of the nervousness that's afoot in the economic world, and that will only continue and presumably increase the longer this contagion continues.
All right, Mark, thank you so much.